Obesity and end-stage renal disease, patient study. Clinical presentation. Mr. C has several clinical presentations of an underlying disease condition seen from the subjective and objective data. The client is obese, as evidenced by the patient's reports of gaining more than 100 pounds in the last 2 to 3 years. The objective evaluation of his weight and height shows that his basal metabolic index is high, indicating obesity. Moreover, the client has problems with fat metabolism, evidenced by high cholesterol levels, elevated triglyceride levels, and decreased high-density lipoprotein levels. Furthermore, the patient has an ineffective circulatory mechanism due to the increased blood pressure of 170/98 millimeters of mercury, shortness of breath, pitting edema, and raised heart rates of 98 beats per minute. The client has problems with glucose metabolism due to elevated fasting blood glucose levels of 146 milligrams per deciliter. Finally, the patient has difficulties with the excretion of waste in the kidneys. This is seen by the increased serum creatinine and blood urea nitrogen, BUN, levels, pruritus, and swollen ankles. Potential obesity health risks. Mr. C has numerous probable health risks due to his disease state. First, the patient is at risk of dyslipidemia due to the high cholesterol and triglyceride levels with a decreased amount of high-density lipoproteins, HDL, in the body. Obesity results in impaired metabolism of fats in the liver, resulting in elevated fatty acids and reduced HDLs in the patient's system. The high fat levels in the blood also predispose the patient to the possibility of suffering from clogging of the blood vessels by fat tissues, atherosclerosis. Disruptions in the blood flow by fat embolus can cause a stroke in the patient. Moreover, the patient is at risk of suffering from type 2 diabetes mellitus. Obesity impairs the functioning of the body to regulate heightened blood sugar levels. The patient qualifies to undergo bariatric surgery due to his high BMI, continued weight gain of 100 pounds in the past 2 to 3 years, sleep apnea, and hypertension, which are complications of obesity. The awareness of the potential risk factors in obese clients enhances their time management. Functional health patterns. The functional health patterns are 11 guidelines by Gordon that outline the holistic management of the patient. An evaluation of the patient's signs and symptoms shows several disruptions in these functional elements. First, the nutritional metabolic pattern indicates that the client has had difficulties in consuming fluids and food. This is evidenced by the significant weight gain of about 100 pounds in the previous years. Second, the assessment of the sleep, rest, and relaxation pattern shows that the patient has impairments due to a history of sleep apnea. This pattern involves disruptions in sleep quality due to frequent cessation of breathing and snoring, making the client feel tired when waking up. Third, an assessment of the health perception indicates that Mr. C has a good perception of his health. He is aware that he has hypertension, obesity, and sleep apnea. Fourth, an analysis of the activity rest pattern shows that he has poor exercise habits. Judging from his work as a telephone operator, Mr. C spends much of his day sitting down and minimally exercising, contributing to the weight gain. Finally, an examination of the health management pattern indicates that Mr. C has good health management practices, which is seen through his going to the hospital to qualify for bariatric surgery. Staging of the end-stage renal disease. The basis for staging end-stage renal disease, ESRD, is the impairment in the glomerular filtration rate, GFR. Stage 1 involves kidney damage with normal or near-normal kidney function with a GFR of over 90 milliliters of cleansed blood per minute per body surface area. Stage 2, 60 to 89, Stage 3, 30 to 59, Stage 4, 15 to 29, and Stage 5 is a GFR of less than 15 milliliters per minute per body surface area. The contributing factors to ESRD include poorly controlled type 2 diabetes mellitus and high blood pressure. Health promotion in ESRD. Mr. C requires health education and health promotion services to prevent future events, health restoration, and avoidance of deterioration of renal status. First, Mr. C should adopt an appropriate diet, engage in physical activities, and evade stress to reduce weight gain and avoid an increase in blood pressure. Furthermore, he needs to seek high fasting blood sugars, elevated cholesterol and triglycerides, and increased blood pressure, indicating type 2 diabetes mellitus to reduce further disruptions in kidney function. Moreover, undergoing bariatric surgery is necessary to reduce the weight to the desired range according to age and sex. Resources for ESRD. Patients with ESRD require specialized resources and care from a multidisciplinary team. First, they need to be put on a dialysis machine to excrete excess fluids and electrolytes effectively. Second, the input of nurses, nutritionists, and physicians is beneficial for managing this condition. Nurses are useful in helping clients meet their activities of daily living, including eating, ambulation, toileting, and clotting. Nutritionists are integral in instituting a proper dietary plan for patients with ESRD. Furthermore, physicians are required to treat the condition and other complications. Good multidisciplinary collaboration is critical in managing clients with ESRD.